Hi, I'm Marc Gorelick, President and CEO at Children's Minnesota. I'm here today with Dr. Angela Goepferd, who is the Medical Director of our Gender Health Program here at Children's Minnesota. And she's here to talk with us today about International Pronouns Day. Thanks for being here.
Thank you for having me.
So clearly how we address people matters a lot to adults as well as to kids. Maybe you could start by talking about pronouns. What are they and why are they so important?
Sure. Well, pronouns simply is the way that we refer to people in the third person, which is typically he or she, or often we're now hearing they. And it's really important because it's a reflection of someone's identity. So you're really saying, I see you, I see how you identify, and I want to reflect that. And it's really more important than you would think. I think a lot of us don't think about pronouns, but what we know, particularly with kids, is that it's very important. And there was a study in the Journal of Adolescent Health that showed that kids who are consistently referred to with the pronouns that they prefer have less depression, less suicidality, and overall just do better.
So it's a great concept, not something we're often accustomed to. So walk me through this. How do I go about doing this?
So a great way to get someone else's pronoun right is to introduce yourself with your own pronouns. So when you walk into a room, you can say, "Hi, my name is Dr. Gorelick and I use he, him pronouns. What pronouns do you prefer?" And then someone can give you back their pronouns. And if you don't know someone's pronoun, you can just ask them, what are your pronouns? Sometimes people are worried that when you ask what a pronoun is, someone's not going to know what that word is. And I ask kids that often, what your pronoun is. And if they don't know, then I'll usually follow it up with, are you a he or a she or a they? And give them some choices, and then they can answer back for me.
I have to be honest, for some of us, especially those of us who are a little bit older, this can feel kind of awkward.
Sure.
So any tips on how do we get more comfortable with it?
Yeah, I think the more you do it, the more you get more comfortable. I think we need to normalize it a little bit. So I've noticed in your email signature, for example, you have your pronouns listed, and I do as well. And I think when we start to just normalize that a little bit, it gets easier. But the simple fact is we're going to make mistakes. I've made mistakes with people's pronouns, and we're all going to make mistakes. And if we do make a mistake, the best thing to do is just apologize and move on. I'm sorry, I meant to say whatever the correct pronoun is, and then kind of move on.
Well, again, it's obviously important to people. As you said, it's part of their identity. So thanks for the tips on how we can make our patients and families feel more included and more welcome and more respected. And thanks for coming to talk about this important topic.
Sure, absolutely. Thanks again for having me.